Hi, my name is Devi and I'm the National Professional Officer for Environmental Health and Climate Change. And my portfolio covers water and sanitation and also hygiene, waste management, food safety, chemical safety, climate change, and air quality. So working at the country level, my main roles is to support the government, counterparts, and coordinate with other stakeholders as well in the formulations and the implementation, and also monitoring evaluations of the environmental health policy and implementation. For example, participating in the discussions on the safe drinking water regulations and the implementations of water safety plan in Indonesia.
Hi, my name is Dave Trouba, and I'm with the WHO Water, Sanitation, Hygiene, and Health Unit. My particular role is to support country offices with capacity building, but also to support the Geneva-based unit with communications and collaborative work. Here in Bali at the World Water Forum, it's been a great experience for us because we've had a chance to talk quite a bit about WHO's work, to explain how we see it as being helpful in accelerating the progress that needs to be made to achieve SDG targets 6.1 and 6.2, and also to meet with a whole bunch of our partners, whether they're UN agencies like UNICEF, bilateral agencies like Agence France Développement, or NGO partners such as WaterAid, Water for People, also AMCOW, and others. It's been a really wonderful experience.
In Indonesia, when we are talking about addressing wash issue, it's probably not only health sectors, because it also involves a strong commitment from the public work and infrastructures, from the environmental health, and probably in the decentralized structures like Indonesia, it also involves the provincials and the district or the municipal level governments. So the strong policy at the national level and multi-sectoral collaborations and engagements at the local actors are the keys. Just to give you an example about one of the challenges in Indonesia, so despite the extensive progress of the national government in reducing the proportions of the open defecations, so we still have a significant issue on unsafe on-site sanitation, for example, and the prevalence or the proportions of safe drinking water. This forum is important for me and for WHO, as I can engage with international experts, policymakers, and practitioners working in WASH, and learn from other partners and countries on how they tackle issues around water sanitation in the events of climate change, and also share the best practices that we have been supported in Indonesia's government. So during these missions in the World Water Forum in Bali, I had an opportunity to talk about the climate resilience in sanitation systems and the health risks of inactions. I use these forums also to advocate the importance of boosting resilience of sanitation system through WHO sanitation safety planning, and the importance of the water safety to the public health.
WHO, of course, is an agency that works quite a bit with WASH. For example, in developing normative standards and guidelines on drinking water quality, also on sanitation and health, and next year on hand hygiene in community settings. So we've had a chance to talk about those, as well as the monitoring work that we do through the WHO-UNICEF joint monitoring program on water supply and sanitation, and the UN Water Glass, which looks at the enabling environment. Here in Bali, we've had a chance in particular to speak about climate resilient sanitation, as I mentioned, but also WHO's emerging work on wastewater environmental surveillance, which we see as a really important method and protocol for being able to identify diseases before they become widespread and transmit even further, leading to pandemic or endemic situations. We've also had a chance to speak about the forthcoming pandemic preparedness treaty, which WHO is negotiating with member states.
The World Water Forum in Bali delivered powerful insight on drinking water, sanitation, and how the climate change can impact on health through coarse water and sanitation. I think the key takeaways include the critical needs for integrated drinking water safety, and also the sanitations, and also the innovative technology to ensure sustainable and equitable access for water services. Strong policy framework is also needed, as the strong governments are really essential for effective implementations. I think the most important thing is also to engage the community as like a vulnerable populations in the planning, implementations, and also monitoring and evaluations in every process in WASH programs. I think this is can ensure that no one left behind. So I think everyone should involve in WASH program. You and I and everybody can be the WASH warriors.